JANTZEN, both from the Tufts University School of Medicine. I'll introduce Dr. MINUTELLO first. Dr. MINUTELLO began his educational career receiving a Bachelor of Arts in Religious Studies from the College of Holy Cross, and then a Master's in Theological Studies from Vanderbilt University in 2003. He completed his doctorate in study in education at the university, at Pennsylvania State University in 2016. And his dissertation the title was Why and How They Decide to Leave, a Grounded Theory Analysis of STEM Attrition at a Large Public University. He began his academic career as an academic specialist at Quinnipiac University, and then transitioned over to his current role as Associate Director of Academic Support at the Tufts University School of Medicine, residing in the Office of Student Affairs. Dr. MINUTELLO focuses on imparting teaching strategies and coaching strategies to faculty, as well as spending a great deal of his time working with medical students on their test taking and study skills. Dr. MINUTELLO has published several articles focusing on metacognition, on retrieval of previous knowledge using concept mapping, and on reflective writing. And then Ms. JANTZEN received a master's degree at Wake Forest University, Winston-Salem, North Carolina, in counseling, as well as a bachelor's degree from Mount Holyoke College in Massachusetts with a degree in English. Ms. JANTZEN started her academic career as a 7th grade English teacher. So I think that gives her a lot of credibility with this topic before transitioning also to Quinnipiac University, where she has been adjunct faculty, and then again transitioning to work within the Tufts Department of Medical Education, but working here in Portland, Maine, where she works with 1st and 2nd year medical students, helping them be successful with the USMLE exam and imparting other test-taking strategies. She also works with veterinary students at the Cummings School of Veterinary Medicine at North Grafton, I guess it's at North Grafton, Massachusetts. So without further comment by me, I will transition over the talk to Dr. MINUTELLO and to BRENNA JANTZEN.
Mary, thank you. This is great. We are really excited to be here. Our hope is to really present a grand rounds that will give a good picture of how this pandemic over the last 14 months or so has begun to affect the students. And in order to do that, we obviously have a fair amount of experience in working with students. So towards the back end of the presentation, we'll be trying to really give professional thoughts and just observations on how students have felt during the last year or so and the challenges that they faced, as well as some strategies for how we as either as specialists or as teachers or as parents can help students to just adapt to this new environment better. And then before that, we will be discussing what is the findings of the research that's been published over the last year or so into how this pandemic has begun to affect students.
So we have 3 main learning objectives for today. The first is to gain a deep understanding of how past natural disasters and pandemics have impacted student outcomes and what we can learn from that in terms of this current COVID-19 pandemic. The second is to summarize some of the early research that we have on how the COVID-19 pandemic has impacted student learning and also student mental health. And then the third is to talk about some of the practical implications that metacognitive and executive functioning skills can have on student learning, especially in the hybrid and the online learning environment that many students are still using for their schooling.
And I think a good place to start is just a broad level view of just how many students have been just affected by things over the last year or so. One stat that we found was that 77 million plus students have been affected by their schools being shut down at some point over the last year. And then in particular, it's of course important to note that schools have not been closed over the last year, but students have been forced to learn in a range of ways that they are not really used to. So for example, this stat from, I believe it's October of 2020, found that about 2/3 of students were forced to learn from home, like online, which oftentimes involving being on Zoom. But that's not the only mode of learning that was found. A bit over 20% of students in October 2020, they reported that school was just shut down, that classes were not being held. 15% or so had reported that they are having to learn from home. However, it's not online, but the schools are actually sending out old-fashioned paper and pencil types of things, like things to do for homework. And then around that same percentage had reported that the mode of learning was actually something else, something that wasn't even being really described on the survey. And then around that same percentage also said that school was being held in person. So I think as we begin to unpack the topic, I guess it's important to first note that students have been forced to learn in a range of ways. And that can obviously just affect students in a range of ways.
I'm hoping this video is going to work. So let me know if you can't hear it once I hit play. I think the most important thing here is we want to keep the students' perspective and the students' voices central to the information that we're presenting. So they are all impacted by the change in schooling. And so the United Nations Educational, Scientific, and Cultural Organization put out this video, which has students from across the world and some of the things that they have experienced during the school shutdown. There's also a teacher who speaks. It's just a few minutes, so we're going to watch that to kind of give some perspective on what students are saying about this time for them.
March 2020, we really thought lockdown would only last for 2 weeks, but now here we are 1 year later and the pandemic is still not over. Now, a lot of things have changed in my life this year. First of all, I graduated from high school. I was so excited to start this new chapter of my life. I mean, I'm a college student now. I felt like I was unstoppable, but we are still learning online. And the worst part is, I don't know how my teachers look like. I don't know how it feels like to walk into the hallway of your college with pride because you're an adult now. I have never thought that this is how my college experience will be, but things don't always go as planned.
I'm coping pretty well. We resumed school a while ago and it has been stressful, but we're just trying to retrieve back what we lost during the quarantine and catch up with our current syllabus. As of right now, I would say that the worst thing about not being in school is the amount of work that you miss. Because as we all know, learning behind the screen and learning in person is incomparable.
The virus has influenced all of us. All of the Russian students were moved to an online study. Needless to say, it was a rough year for all of us. I mean, a lot of my friends were struggling with a little depressive mood. They were missing their friends and teachers. So did I.
Soy maestra de educación preescolar en el Jardín de Niños Ignacio Manuel Altamirano, el cual se encuentra en la ciudad de Monterrey, del estado de Nuevo León, México. El contacto ha sido positivo y negativo. Negativo por el hecho de no poder vivenciar cada momento de los alumnos, pero positivo porque nos dimos la oportunidad de explorar nuevos métodos de enseñanza que han enriquecido al alumno y sobre todo a las personas ajenas a nuestra profesión le han encontrado valor y dificultad con lo que se ejerce.
It has been a year since the online learning began in Indonesia. When the pandemic started, I was a year 11 student. Now I'm preparing to get into university. The past 1 year had been really hard and tiring for me. I'm sure most students would feel the same. At the beginning, it was really hard. Most of us were unprepared and didn't expect any of the situation. Not being at school for almost a year made me somewhat lose the chemistry between school and student. It's very hard to explain. This semester will be my last semester in that school, so in fact, I'm really sad. It seems like I don't have enough memories and stories with the teacher and my friends. However, we need to keep fighting. There are a lot of lessons learned we've got from this situation, so we need to stay motivated.
We've been all fighting against the COVID-19 pandemic for a year, and schools have closed all around the world and have now opened partially in Hong Kong. And we've been learning online for the past year, and teachers have gave me good guidance so I can learn and work online. And I do miss my teachers and friends a lot.
So as we move forward, I think a couple of important questions for you all to consider are: what challenges are families reporting to you around online and hybrid schooling? So we just heard some challenges that students are reporting: missing their friends, missing their teachers, missing the structure of school. But are you hearing other things from families when they come in to see you? The other thing to think about are: what are your biggest concerns for your patients moving forward? So as students return to school full time, what are you seeing as kind of the red flags or the concerns that you might have moving into the fall? We're not going to talk about these now, but we are going to have time for Q&A at the end. So if there's topics that you've come up with that you would like us to chat about that we don't during this presentation, we'd love to hear them.
Great. And then I think as we make this leap into the next phase, before we talk about all the research that we found that was published like recently on the pandemic, what we found was that there were articles that we found that were citing some research that had been published about some pandemics and other things from the past that have really affected them students and them how they learn. So we thought it would be a good place to kind of start there. So just for example, there was an article published in 2018 about this earthquake in Europe in 2009. And it found that students closer towards the fault line actually had a probability of dropping out 3.4% higher than the year before. So as we could see that, being involved in something that disrupts schooling can affect students and their either ability or their just desire to actually remain in school. And one other article that was really interesting was published involving the polio pandemic from back when in 1916. And they also found that students who lived in physical areas that had higher rates of infection also had a lower attainment of years of being in school. And then finally, this other article that was published in 2020 about this earthquake in Pakistan in 2005 also found that students who live near the actual fault line, in terms of their scores on exams and on tests, the amount of learning that took place was actually less. And what was really fascinating about this article was that they found that the impact of the earthquake wasn't just about 1 year, but the impact in terms of learning happened for years and years and years. So this quote we actually pulled out, we think is really insightful. And it basically, I'm just going to paraphrase it, but it said that the kids who live near the earthquake actually learn less every year after they returned to school. We don't know why this is the case. One intriguing possibility is that every child had to be promoted in the new school year. And if teachers taught to the curriculum in the new grade, then the students could have fallen further behind. And I think as we go through the presentation, at least in my opinion, this quote is really, really important, because I think that this topic isn't just pertinent for this upcoming year or for the following year, but this topic of how the pandemic has affected students is going to be something worth like watching for years and years.
So the other thing we wanted to look at was how the COVID-19 pandemic has impacted student mental health. We're going to talk in a moment about the connection between mental health and academic achievement. But I think it's important to highlight the impact that this has had on student mental health. So we wanted to take a look at student mental health across the lifespan, so pre-K all the way through higher ed. If we start with college students, they see, so looking at this first article that was published in 2020, this was a study that was done on 2,000 college students from Texas A&M. And it wasn't done until after the pandemic had already started. But what they did find was that 48% of the students involved in the study were reporting moderate to severe depression symptoms. 18% were reporting suicidal ideation. 90% were reporting problems with concentration, and less than 50% felt like they were adequately able to cope with the stress of the pandemic. The other thing that I think was important to note from this study is that overall, 71% of students said that they experienced an increase in their stress level from prior to the pandemic to after the pandemic happened. And their greatest concern or their greatest increase in stress was around their academics and not feeling like they knew how they were going to execute their academic plan, feeling like they were missing things from class, feeling like that they didn't have access to the materials or to the instructors that they needed. Another great study that we found was this second one by Copeland from 2021. And why this one was really helpful was because it's a study up at UVM that was actually already taking place. So they have data from prior to the pandemic where they've been doing a wellness survey with students checking in on their overall mental health every day. And they continued to do this during the pandemic. So they were able to compare what students were reporting prior to March of 2020 to what they were reporting afterwards. And what they found was that overall, the pandemic was negatively impacting the students' behavior, their emotional functioning, their mood, and their attention. Then we took a look at high school students. So the McGuinn survey was done after the pandemic hit, and they noticed that both female students were reporting higher prevalence of both anxiety and depression symptoms than male students. So about 45% of female students were reporting higher anxiety and depression symptoms, and only about 20% or so of male students. And they also noticed that the symptoms were being reported were increasing with age. So the 12th grade students were reporting greater symptoms than the 9th grade students were. I wanted to take a look also on the other end of the spectrum to see how our youngest students were being impacted. So the Glynn survey was conducted with pre-kindergarten students, so 3 to 6 year olds. It was a relatively small study, but what they did find was that 40% of preschoolers, in using the preschool feelings checklist and the strengths and difficulties checklist for parents, they found that 40% of these preschoolers met the cutoff for a further evaluation for clinical depression. And so it's not saying that 40% of students were experiencing clinical depression, but they met that cutoff. If you compare that to, they administered the same survey to a group in 2019, and they only found 5% of the preschoolers at that point met the criteria for a further evaluation. So they are seeing some sort of increase here. This obviously has an impact on academic achievement. So Mike's going to talk a little bit about the impact that the COVID pandemic has had overall on academic achievement.
I was on mute, and that happens. So now that I'm unmuted, we were able to find a few articles that began to analyze and to study how the pandemic has affected the, students in terms of learning. And I think the first article, Engzel, from 2021, is probably, in my opinion, the best article. And I believe that was done with fifth graders. And it was able to just analyze standardized test scores from the year before the pandemic started, and then it as compared to results from spring of 2020. And it found that, at least in this one particular institution, there was a for sure a worsening of the scores. And it says that in their in terms of the stats of it, it said that students in the pandemic lost approximately 1/5 of a school year. But when I went back and I reread the article, that stat isn't not really accurate, because in most years the numbers would have actually gone up. So for instance, instead of staying flat in most years from year A to B, students would have gained an amount of knowledge. In this study, the students actually went down. So they actually went, instead of improving, they actually went down. So that's definitely something worth to note. And then I'm going to kind of hop around a little bit to Kufeld 2020. This was an article that used previous just research into the amount of students who lose like learning during summer months. And it used that model in order to just to make a statistical model to estimate during the pandemic how much learning students have basically lost. And it found that between spring of 2020 and fall of 2020, that students, according to the model, they would have begun the year with only 63 or so percent of the typical gains in reading, and only 37 to around 50% of the typical gains within math. So obviously those stats are pretty, stark. Kaffenberger also wrote an article in 2020, and this used quantitative modeling. I'm not going to go into the stats of it because it was a little confusing, but at least according to this article, they, according to their best guess, felt that third graders would lose approximately 1.5 years of learning by the time they reached 10th grade. And I think when we read these two articles, I think what's important to note is the quote that I read before about how in that study in Pakistan, how they found that the amount of learning loss, it did not just occur in that 1 or 2 years post like pandemic, but it occurred for many, many years later. And that's something I think worth to note. And then as we talk about the amount of loss of learning during this pandemic, we found this really good conceptual just model that kind of explains why students would not be able to learn as well. And I think as we see this in the context of all of the mental health just challenges that has been mentioned before, I think this makes a whole lot of sense. So for example, this one model, it presented 4 different reasons why students basically at home during this pandemic would not learn as well. So for example, there was one survey that found, I think it was from the spring of 2020, that found that students were spending less time trying to learn, like doing homework, reading, things like that. So if you're home all day, you're not potentially spending as much time learning as what you would have done if you were within school. The other reason, or the second reason, which I think we all can understand, is students are, potentially reporting higher levels of stress. So if you're stressed, that obviously can affect your concentration. It could affect your just desire to learn. Third reason, which I think for me makes a whole lot of sense, is that once you switch to the online environment or these other kind of like modes of learning, when you're not physically in school, that changes the way students interact. And I think the word for interact, I would put on in terms of how they mix and mingle with their peers, and also how they just mingle with how they learn. So for example, oftentimes, even for us, students have complained that during the pandemic, there's not the ability to work in a small team, to kind of do a group study work, and that could be really, really just hurtful, because there are a whole lot of students who learn best by talking things out loud in a small group of peers. And then the fourth reason that was mentioned in the model is that students potentially have a lack of learning drive, right? So again, like in the articles that we mentioned about all of the mental health factors, if you're feeling more stress, if you're feeling more down, if you're feeling more anxious, that just desire to learn can really be hurt.
Which leads us to the connection between mental health and academic achievement. So we wanted to end with this because there's real interplay that happens between student mental health and their academic achievement. We also don't know moving forward what of the mental health challenges that have cropped up during this time are going to persist for students. What we do know are things like PTSD, anxiety, and depression can predict poor academic outcomes for students. If they have outside factors or mental health issues that they're trying to manage, it makes it harder to fully engage in their academic experience. The other thing to think about is that trauma exposure can increase the risk of students leaving school prior to graduation. So if we look at the pandemic broadly, there's certainly opportunity for trauma exposure here. Students whose parents have lost jobs, if they're in an unsafe home environment, if they've had someone die, there's certainly traumas that have happened due to the pandemic, and that might have lasting implications for students' ability to complete school or to meet their academic goals. So I think keeping this in mind, not only now, but as we move forward, will be really important to see how the mental health components are going to continue to impact academic achievement and academic experience.
And Brenna, just to pause for a second, I think one thing to maybe mention is we both read a real fascinating New York Times story that I think was published last week.
Yeah.
And it was really stark in that it gave a firsthand account of students and how they've been able to cope. And there were many, many stories of students feeling extremely anxious, extremely down. And I think when you either hear it or you read it in terms of these stories, it really puts this topic in a really stark light, in that students really haven't done well, right? And they're not able to cope like maybe we are, right? So that's something to just bear in mind. And I'm sure if we can, certainly share that link.
And I think the other thing to note is the study they did on students after the earthquake in Pakistan. One of the things that they emphasized was that they saw educational attainment disparities and inequities increase because of this. So the gap got bigger for students who were also experiencing outside factors And so I think thinking about that as well, how has the pandemic increased the disparities that were already present in our society, the educational inequities that were already present? And do we see that as a factor moving forward?
So I think here, this is where we would like to extend just our personal thoughts and some just observations on how either switching to online environments broadly and obviously during this pandemic, what are the challenges that are being faced in terms of trying to learn, by students? And then as we discuss those challenges, our hope is to also offer some tips that could be used to really help students cope more. So the first challenge that a lot of us can certainly probably relate to is this idea of home is now school, right? So especially if in terms of those students who have switched to having to be at home and potentially being on Zoom in order to learn, there obviously are a lot of problems with that. So the first two problems that I would like to mention, so the first one is that when you are, basically forcing students to learn from home, not every student has access to technology. So for example, there are a lot of students don't have access to a home PC, to a computer that's adequate for the type of schoolwork that they need to do. Even if they have the PC or the laptop, in terms of Wi-Fi in a lot of areas around our land. Students don't always have that. So if the access to being online is spotty and you're encouraging or forcing students to learn online, that could be a big problem. The next problem is that for a lot of students, they don't have the type of help and support at home. So for example, if your parents are at home, if they're not at home, if they're working, and you're basically forced again to learn from home, that could be a challenge. The third problem that we think is really important is that for a lot of students, that when you're and for parents, when you're at home, there are certainly many demands and just outside distractors. So for example, in that article that I was just, trying to like describe, they mentioned that one student, I think she was in around 9th grade or 10th grade, was saying that when school switched to online, that when her and I think it was her brother, were now both at home, her parents who had to work, basically asked this daughter to actually take care of her brother, right? So now there's, potentially a student in 9th or 10th grade trying to learn at home, trying to do Zoom, trying to do her homework. And she's not just trying to do that by herself, but she's trying to do some other tasks. So that can obviously be really challenging. And then, of course, besides for anything that that drastic, just the regular type of issues and challenges that students face being online, right? So when you're being, encouraged to learn online all day, and you don't really have a strict schedule of a physical environment to actually go to, that could be problematic just with that. So in terms of just a few ideas that we wanted to float around in terms of being able to help students, I think that to the extent that parents are able to establish a regular process where students wake up at certain times, they're in bed at certain times, they start working at certain times, they stop at certain times. I know for me, I'm a big believer in, having certain hours where you work and then certain hours where you're just off. And I think that students, especially again, people who are working primarily online could really use that. And then in terms of being able to help them with that, there are some apps that we felt would be worth a mention. So especially if the issue is when you're online all day, if students are being just distracted by being on Facebook or just being on other sites that can kind of be distracting, there are apps that are out there that can do things like blocking those sites that are just distracting. There are other apps that I'll mention just in a minute that can help students stay on task. So that's worth a mention. And then finally, another big strategy is, and I could definitely speak to this just in terms of my work with students, that oftentimes students, when they're working at home and they're working online, can get really bored. And they're getting bored from simply, watching of resources, from watching things all day long. And they get lulled into this sense of just passiveness, where they're simply trying to really just consume things. And when you're in that mode of learning, I think that could be a distractor just by itself. So the extent that we can encourage people to be active would be really helpful.
The next challenge we wanted to talk about is executive functioning and self-regulation. So I don't know how many of y'all have been in a elementary or middle or high school recently, but the structure and the routine is built into a student's experience there within the individual classes and within the school as a whole. And when you take that away, suddenly students and families are left to figure out how to use their executive functioning skills, use their self-regulation skills in a way that they may not have had to prior to this. So this can lead to several potential problems around time management, around organization. Students can also struggle with the intrinsic motivation to do work if they've prior to this have had extrinsic motivation in school. If they don't have the social pressure around academics, being in a classroom where everyone else is doing their homework, so you're also going to do your homework, that can reduce the completion of their academic tasks. And it also limits the opportunity for help-seeking behaviors. If you're not around your teachers to ask questions, if you're not around your peers to ask questions, then you may not naturally ask for help when you need it. And that kind of limits the opportunity there. So we came up with a lot of suggestions that families and students can use kind of across the school experience. So from our littlest students to high schoolers and college students. So the first is having some sort of to-do list or chart that actually keeps track of what students need to do every day. When you're in a classroom with students, usually what their agenda is posted right up in the front. So students know exactly what it is that they need to execute that day. And so replicating that at home to the extent that it's possible can be really helpful. This can be as small as having something with visuals for elementary school kids, and as much as using a to-do list app like Todoist for high school or college students. The other thing to think about, and Mike started to touch on this, was a weekly or a daily schedule for students so that they know when they're going to be doing different tasks. And this, if kids actually help create this, it can add some ownership and some agency for them, so they're more likely to execute it. Again, you can add visuals for younger students so that it can help them actually physically see what's happening. If students are really struggling with executive functioning or self-regulation, you can also use something to show where they're at in their day, a clothespin or a marker to kind of show where they're at. And that can help students feel like they are in control, that they have a routine, and that can be very helpful. Another strategy that we often use with students is the Pomodoro method. So the Pomodoro method is based on the idea that most people start to lose focus somewhere between 25, 45, or an hour after they work on a task. So we cannot work kind of to infinity. We have to take breaks so that we can maintain our focus. this might be even a shorter period of time for younger students, even 10 minutes might be appropriate. But having some sort of visual marker of when they are working on a task and when they are taking a break. So setting a timer for 25 minutes and then setting a timer for a 10-minute break or a 5-minute break. There are apps that actually keep track of all of this for students. Either Focus Keeper or Tide are great. The other thing that I have used with younger students that works really well is a sand timer, so they can actually see the time moving, and that can help students have a visual or of, I'm going to work on this for 25 minutes and then I'm going to take a break when the sand all gets to the bottom. When we think about intrinsic motivation, oftentimes having some sort of small reward can be helpful. This is obviously not truly recreating intrinsic motivation, but I know that for myself, when I have a task that I don't want to do, I set up some sort of small reward for the end of it so that I have something to work towards. And the same thing works for students. So talking to students and working with students to figure out what is it that would help them get motivated to complete a task, and then creating some sort of system around that. The other thing that can help is school-related time with peers. So if that's studying outside with friends or studying on Zoom with friends, but having some sort of social experience around academics. And then the last thing around help-seeking behavior is trying to support students and having some sort of regular teacher check-in. This also might look like helping students brainstorm what they need to talk to their teachers about. So they might not know the questions that they need to ask. Often teachers are really excellent at anticipating student questions in class and already answering them for their students. So they might not have a lot of experience trying to think of what they're confused on, put it into words, and then actually execute going and talking to their teacher about it. So setting up some sort of time during the week where students can think of what they need to ask their teacher, maybe even write it down and then bring it in if they're in a hybrid model where they're actually going to see their teacher, or talk to them during their office hours on Zoom can be really helpful.
And then third is our, I think, Brenna, our, bread and butter, as we were saying before, in that a lot of the work we do broadly, even besides for online just learning, is that students, just naturally have this desire to learn in a passive manner. And I think with the pandemic, and again, being switched to mostly online, types of modes of learning, I think has really made this worse. So for example, back to the idea of Zoom, if students are on Zoom all day and they're being encouraged to watch and to listen to either presentations or different types of class sessions, there's this just a tendency to watch without really just to actively process things, right? And that's not just an issue for younger students. I mean, that's in high school, it's in college. That's a medical school thing, right? So anytime that a student is learning online, I think it's worth to note that that is not really how we learn. So the watching of the video or the hearing of the video, that's not the end product, right? And then I think the issue for that is that could be really challenging, because students oftentimes, when they are hearing or watching things, they feel like they actually are doing the task. Like, okay, I watched this, or even if there's a textbook involved, I read this. And then students feel like they have learned, when in actuality, they really have not. And then, of course, just with the pandemic and trying to work and learn from home, they obviously have less contact with their peers, less opportunities to learn in small groups. So a whole lot of students, even within our work here, Brenna, have mentioned that for them, a major challenge is not being able to learn in a small group. So with that being said, what are some ideas for how we, either as parents or as teachers, can help or prompt students to learn better and to get more active instead of passive? I think the first idea I would mention is encourage students or families to buy a whiteboard and you could put it in some area that the student likes to learn in, and encourage them to really rewrite out, to redraw things, to really engage with the concepts that are going to be either on their exams, or if they have to write a paper, they could, like use the whiteboard to jot down ideas. I think oftentimes this process of writing and thinking about it on the whiteboard can be really helpful. Next, I would mention the use of flashcards. I know that for some people, both in terms of professors, teachers, and students, flashcards can be a little bit of a controversial topic, but there is plenty of research that suggests that act of re-teaching the information is as a learning strategy really important. And flashcards by their nature, as long as you're actually doing them right, can be really helpful. Third, I would mention, even if you don't have a peer group that students can actually get involved with, you can encourage students to still teach things out loud, teach things to their parents, to their peers, even on Zoom, teach things to anyone who's within the actual just household, just environment. And then finally, as they watch all of these things on Zoom, if anything is pre-made and they have the ability to start and stop, to encourage students to not just watch a video from beginning to end, but encourage them to pause it, and pause it either every slide, every few minutes, and encourage them to really re-paraphrase what is the main idea. So to go back to the idea of the whiteboard, if you hypothetically have a whiteboard, then what they could do is watch, pause, and then write.
So we wanted to provide you all with some resources if you're interested in learning more about either study strategies or metacognition as it relates to academics, or active learning strategies. So the first two, teach students how to learn and strengthening the student toolbox, are really geared towards kind of older students, high school, college age students, and have really excellent strategies around helping them figure out how to learn in an active way that works for them. The third one, Make It Stick, is a great book on what kind of the major active learning strategies are and why they are effective. And then the last one, The Learning Scientists, is a book and also an excellent blog. And on the blog, they have a whole section on online and hybrid learning strategies that's geared towards families. So helping families figure out how to create routines, how to have students develop habits, how to have students develop strategies that work in the online and hybrid setting. And you can actually just find that on their blog, and it's very, very helpful. So I think that would be a useful resource as well. So this is kind of the end of our planned content, but we are happy to take any questions that folks have.
Thanks. That was really an excellent talk, Michael and Brenna. And I think that your suggestions are wonderful. One of my questions is, how much have schools embraced some of these solutions, and is there any push for them to address the concerns that you bring up by parent groups or government, or whoever can put pressure on teachers?
I don't know, Brenna, what you have thoughts on, but I think one broad thought that I would extend is, I think in our experience, many students, and I would presume parents, don't really know much about this stuff, right? Because even when we work with medical school students, a lot of times they don't really even think about these things. It's like they've always done things a certain way, and they just assume just naturally that they can kind of keep on doing it in that way. And I think the switch to the online environment can kind of place the added stress that, well, maybe I do need to make a switch.
Mhm.
I think the other thing to note is, and I'm biased as a former teacher, so I'm just going to name that up front. But I think most teachers would be open to using some of these strategies if they have the time to think through remote learning that incorporates it. And I think this switch has happened so quickly that teachers are really doing their best to keep up. I also think most teachers are really willing to work with families. And so if they are coming in and saying, this isn't working for my kid, what can we do? Or I have these ideas. I think that collaborative relationship can be really helpful to figure out what might be effective for the individual student and their individual needs.
Thank you. There's a couple of comments and questions in the chat box. One is from Dr. Jenny Jubilis. How many of mental health challenges are due to online learning versus loss of parent versus parent job loss, et cetera? I imagine this number would be different based on setting. There was a New York Times article a couple of weeks ago describing that even during the pandemic, the main source of teen anxiety in suburban areas was parental pressure to succeed, and that may differ across different settings. How is research accounting for this?
So I actually haven't seen a lot of breakouts in that way, which I think is a really good question. That's part of why I was so intrigued by the study at Texas A&M, that the biggest stressor was academic performance for students. I think that probably was also based on the population that they were able to get as part of their study. The article that Mike was mentioning in the New York Times, I think it was last week, had a lot more focus on the experience of students whose parents who have been sick, whose parents have been essential workers, who have lost a family member. And I think that is a really good resource if you're looking to kind of find out about the mental health component of what's going on.
And I think that also it brings up a good point that a lot of the research obviously is brand new, and this is going to be a topic that is going to be studied for years, right? Both in terms of mental health, in terms of outcomes, in terms of learning. So we really are at the first stage of this. And I think also that question, it brings up a good idea in that although we've all been trying to deal with this pandemic in the best way possible, we need to be really flexible, like flexible with ourselves, flexible with students, because everyone is really dealing with things right now, right? And I would imagine, especially for students, you know, I think one of the thoughts that I had as we were preparing is that students in general like things to be neat, and they like things to be on a very straight path. And when anything that kind of threatens that straight path is brought up, that could cause a whole lot of stress. And I think that that's, just a thought worth just having. And if you do have either a student at home as a parent, if you're a teacher or a professor, just being able to really give out that idea of things are still okay. Even if things aren't a perfect straight line, things will still be okay. And even in our work at Tufts, I mean, students studying for step 1, people studying for step 2, people studying for exams. I mean, that stress is still there.
I also think it's going to be important to continue to have practitioners both in the medical field and also in the education field. Think about how they're incorporating trauma-informed practice into their work. We've experienced essentially what's been a collective trauma with the pandemic, and individual students have certainly experienced additional traumas. And so even as things return to closer to what they were prior to the pandemic, those traumas don't disappear, and they're going to have a lasting impact on the student experience. And so any way we can use kind of trauma-informed practices in the classroom is going to support students moving forward.
So there are a couple of other comments in the Q&A. One by Dr. Amanda Goddard. Have you heard that the public schools are planning on not teaching to the standard curriculum? Say if you have a student who's going from 5th to 6th grade and has been remote most of the past year.
I would think that's going to depend on the school. And I think as parents, I would definitely ask about that because, if you have a 5th grader, I would find it really hard to believe that that 5th grader learned as much as he or she would have learned under, normal like environment. And then if they're then entering like 6th grade in the fall, what is the school doing to actually make sure that everyone is being taught to? Because that is, I think, a real problem.
And I think this is also a place where it's hard to generalize. Schools have done such vastly different methods or used vastly different methods to educate over the last year. There have been students who have been in person almost this entire time, and there are students who have not been in a classroom since last March. And so the what they've received in terms of their learning and their curriculum is going to look different from district to district, even from school to school. And so really thinking about for a family, what has their individual child, what has happened for them, and what do they need moving forward to be successful?
And then I think there's time for a couple of the other questions that are in the chat. One by Allison Layton. Is there any data about the lasting mental health impacts of students post-pandemic, and from other types of pandemic or natural disasters? And she's concerned that parents may assume that once the child returns to in-person learning, their anxiety and depression will go away, but concerned that this will be one of the lasting effects of the pandemic.
So I didn't see any in the articles we looked at about past pandemics or natural disasters. What we do know is that one episode of depression or anxiety can significantly increase the likelihood that it occurs again. So I think it's safe to say that this will have a lasting impact on student mental health. I think also thinking about that the resources that we're providing for students access to mental health services, that hopefully that will have some mitigating effect on the student's mental health overall. I'm also hopeful that once people are back in schools full time, they'll have access to the school resources around mental health, school social workers, school counselors, some of the school health clinics, and students will be able to get access to the resources they need if this is going to be an ongoing issue.
And one last question from Carol Hubbard, our division chief for developmental pediatrics. She says that the strategies that you have suggested are great, but there are students that have emotional or other dysregulation, and so they may have difficulty putting those strategies into place, and that home media is such a draw and competing distractor that learning is less appealing by comparison. And so this is an additional stress and challenge.
I think that's entirely accurate.
It is entirely accurate. And I think that, a lot of what we do in terms of the work that we do broadly is really helping students think through things and make, positive choices. And I think even within this environment, I think on that first slide where I was discussing home as school, if we could do anything that gets students to make small just improvements, small changes, making a schedule, and it doesn't have to be a full 8-hour schedule, right? I mean, if they can't handle that, even if they did 2 hours, right? If they did 3 hours, I think that the one thing that I can say in terms of performance broadly is a lot of people and students have broad goals, but they're not able to really make them more tangible. So if students need to start smaller, I mean, I think we as educators need to meet them there.
Yes.
All right, well, thank you again. I think we are out of time, but thanks for a very interesting and informative grand rounds. Lots for us to think about and to try out with our patients.
Thank
you
you.
very much.
So I have a couple of questions,
Sure.
if you guys are still there. So, so I was